welcome all of you to this first event of the Milken Institute School of Public Health's own celebration of George Washington University's 200th birthday. This is our bicentennial year, and we can't be more excited to be a part of that. And this particular session, which we're calling Fearless Science, is about some work that we did a couple of years ago. It's a screening of a film that's been made about the Hurricane Maria research that was conducted by our faculty along with researchers from the University of Puerto Rico and others who joined with us. And as I welcome you all, I want to say a word or two about what you're about to see. This was an extremely important piece of work at the time to everyone in Puerto Rico who was affected by Hurricane Maria. And I think everybody's aware that our research led to an estimate that 2,975 people lost their lives due to the hurricane. A number of recommendations that you'll hear about for how things could have been done better in the future, but particularly how our university rose to a challenge that was extremely difficult, extremely time sensitive, important that we were able to have an objective role and really be a referee for what was a very difficult issue, how many people actually had died from the hurricane. And I'm very proud of how we were able to assemble the data and the best science in short order. I will say, when you see the video, there were many, many heroes, and only a few of them are covered in the video. I'm very proud of those who, the video makers chose to profile. They played very important roles, but there were so many others who were truly heroic, and I don't want to forget those, but also how important this was to those who lost loved ones in Puerto Rico, and more broadly, how important it has been in terms of shifting the paradigm for how we track deaths due to disasters. It used to be, and what people were doing with Hurricane Maria, that we only looked at the deaths that could be directly attributable to the disaster. We said, no, we have to shift the paradigm. We need to count all the deaths that are caused, not just those deaths where the death certificate says that the hurricane did it. And that we already see being brought through in terms of even how the deaths due to COVID are being tracked. Most fundamentally, and I think we should dedicate this session to the people in Puerto Rico who suffered so greatly during Maria, and in fact, the people all across the world who suffer as a result of disasters, whether it's hurricanes like Maria, the ice storm that happened in Texas, the forest fires that have happened on our West Coast, all deserve that we honor them and the struggles that they have in trying to survive these disasters. But it's my pleasure to do some introductions, and I can't be more thrilled than to have with us Mike Milken, who is the person who is, after whom the school is named, has been an incredible supporter of health research, particularly public health. And he's going to say a few words. And then our panelist, Carlos Santos-Burgoa Zarnecki, who is the chief epidemiologist on this project, a very good friend of mine, a very good friend of public health, whether his time at GW, his time at PAHO, his time working for the government of Mexico, and at one point in time as dean of the Escuela de Salud Pública of Mexico, the national university. And so I do have a former public health dean joining me in this. Elizabeth Andrade, somebody on the opposite part of her career trajectory, faculty in our Department of Prevention and Community Health, a behavioral scientist, a communications expert. Dr. Ann Goldman, no relative of mine that I know of, but an epidemiologist, received her doctorate in epidemiology right about the time that we were doing this work on Maria, native of Puerto Rico herself, and somebody who was just an absolutely invaluable member of our team in terms of being able to organize this work. So with that, I'm going to turn things over to Mr. Milken to give some introductory comments, and then the rest of the panel, if you don't mind, just kind of step forward one at a time and speak since I've introduced you all. So Mike Milken. Hello.
Thank you, Dean Goldman. It's an honor to be with you today, and I want to just re-emphasize two of the points before I start you made. One, in many ways, this film honors all those victims of disaster that were not counted and the collateral damage from those disasters for us to prepare in the future. And the second point is the enormous talent at GW and other places that's been brought to bear. And in my 50 years of working in public health and medical research, in many ways, this study will change the future and has already changed the future. So 5 quick points I could make during this opening. First, the Milken Institute School of Public Health at GW. Many people might not remember, but in 2014, established its role as a leading convener when it put on the celebration of science and redefined the importance of public health and medical research, and tens of billions of dollars of additional funding from the federal government can be traced to that event, which culminated at GW. This study has expanded the role and the leadership role in research and as a convener in the public health area, particularly in disaster and preparedness area. Number 2, this documentary that I've had the honor to see not only estimates the excess mortality from the storm, but identifies the procedures that cause deaths to be underreported and access to the communication efforts by the government of Puerto Rico after the hurricane, and what could be done in the future to reduce these collateral deaths. 3, the impact of this study. In my opinion, as I have traveled in the last few years, digitally in the last 12 months and physically prior to that, in my opinion, has changed the practice of public health and the methodology that was developed, not only widely used in responding to the hurricane, but has been extremely helpful in responding to COVID-19 and understanding these issues. And in a series of podcasts that are available at the milkeninstitute.org or mikemilken.com and on Apple or Spotify, and one with Dean Goldman, we looked at many of these areas of collateral damage in other areas of health. But this study, to me, provides a new way for people to focus on this issue. 4th, none of this can happen without leadership. And I really want to commend the individuals, the professors, people who headed departments that worked on this area. It was a difficult project at a difficult time in our country's history and the world's history because of that. And it's been this leadership in the area that brought this credibility. As you all know, Dean Goldman's leadership has recently been recognized that she's now the chair of the board of the Association of Schools and Programs of Public Health. And at our last global conference, where thousands of people joined us virtually from more than 60 countries in the world, we had reached out to Dean Goldman to moderate the session on disaster and preparedness going forward. 5th, the continuing impact of public health, disaster, and preparedness is going to be important going forward. In our virtual Future of Health Summit to be held on June 22nd or 23rd, this is an extremely important topic. And as Hurricane Maria pointed out, or as COVID-19 has pointed out in a sense here, this affects poorer communities more significantly. What can we do in building and preparedness as it relates to hospital, healthcare facilities, healthcare workers, emergency workers? What can we do about food security and water security, power, electric, access to healthcare, access to financial assistance, which can reduce the corollary damages in the future? Disasters such as Hurricane Maria make us all think about what we could have done better at that time and how we can improve both preparation, readiness, and after the fact, particularly in communications to the citizens. This groundbreaking report and work done by the School of Public Health at GW inspired not only me, but other philanthropists throughout the world to try to figure out how we can do a better job. As disasters or unplanned for events occur, particularly in those issues in the poorest community and for those in most need. So Lynn, thank you for letting me visit with the team. Most impressive effort. And I look forward to continuing to share this documentary with my fellow philanthropists around the world that are so concerned about the poorest communities, but also our responses to both national and other forms of disaster.
Thank you so much, Mike. So I think we should now cue the film. Let's see the film.
A potentially catastrophic hurricane is heading for the U.S. Virgin Islands and Puerto Rico.
This is the most serious storm in modern history in Puerto Rico.
Maria is slamming the Caribbean as a powerful Category 5 storm.
The last time a Category 5 hurricane made landfall here was 90 years ago.
President Trump is in Puerto Rico today, meeting with officials and victims of Hurricane Maria.
What is your death count as of this moment? 17?
16 certified.
16 people certified.
There are a lot of questions about the official death toll and whether that number truly reflects how many people have died as a result of the storm.
The official estimated death toll was only 64.
In Puerto Rico, communities were literally cut off from the rest of the world for weeks. And so many people were unable to get their basic needs met, much less to get medical care and other services that they needed.
The government started releasing information that 64 people had died in the storm. People quickly began to not trust that information, and there was a lot of controversy around that number.
This morning, Puerto Rico's governor is ordering an official recount of the death toll related to Hurricane Maria.
On December 20, at night, Dean Goldman called me. She told me that the government of Puerto Rico had got in touch with her and they wanted to have a study on the mortality situation in Puerto Rico.
On the way to the governor's office, we formulated a basic design which said, instead of using the conventional method of just counting the deaths one at a time, we decided we would calculate the excessive number of deaths. And that is, in fact, what we presented to the governor that afternoon, not even 24 hours after we got the call.
I also insisted on having a counterpart inside Puerto Rico, and I insisted to have the University of Puerto Rico.
having collaborators from the island who are not only native Spanish speakers, but also really understand the people on the island, because so much of what we were looking at had to do with the ability to reach out to key individuals, do interviews with them, get their trust, find out what was really going on. We were able to say, okay, then how many deaths would we have expected to have occurred? How many actually occurred?
People knew that they were dying because they didn't have the medicine because of the hurricane, or they didn't have the equipment at home because of the lack of electricity. And that was obviously related to the hurricane.
If someone during the storm was hit by a tree and dies, it's very easy to calculate that number. But what about the person who weeks later still can't get to the hospital to get his kidney dialysis treatment and ends up dying? That's actually caused by the storm. So it's that discrepancy between direct and indirect that needed to be resolved and the deaths counted accurately.
The whole drama surrounding Hurricane Maria was related to the communication. We decided that it was crucial to look at the information that was not provided to the public and how this really guided perceptions. The government of Puerto Rico did not have contingency plans in place that anticipated major power outages, disruption in telecommunications. They were disconnected from the rest of Puerto Rico. This created an information vacuum. The risk is really losing control of the crisis messaging. And that's really what we saw following Hurricane Maria.
It was a very painful process. We had meetings when people started talking about the process and started crying during the meetings. So it was a difficult process for them, but everybody was committed. We had to find out what is the situation, and people had to be accounted for.
And today, a very big day. George Washington University releasing that study, not only saying it should be higher, the death toll, but that it should be 2,975. I mean, that is huge.
Puerto Rico's governor just moments ago revising the death toll from Hurricane Maria up to 2,975. This after an independent study was released today. You may remember the official death count up until now had been just 64 people.
The biggest challenge came when we were releasing the results, and the fact that our results so quickly went into kind of a political world where that number, 2,975, became kind of a point of partisan contention.
There is a new tweet from President Trump, and it's very relevant to today. We've been trying to figure out if the federal government has learned anything from what happened, the disaster that happened with Hurricane Maria.
So it's pretty plain there, Allison, what he's saying about his views of the death toll, but I think we really need to put this in the context of the actual numbers.
My first reaction was, I'm not going to respond. That was my first reaction. I'm not going to respond. He can say whatever he wants.
We couldn't believe it. Got on the phone with Dean Goldman at about 8 o'clock in the morning. She was out of the country. It was probably like 2 o'clock in the morning. Woke her up, told her what happened.
I was in Singapore, and so 12 time zones away. And so my first reaction was that I woke up completely.
And I said, this is a well done study. We had the best statisticians working on this, and we had done it right. So because of the team, I had to tell the world, hey, listen guys, this is good science. We crafted this sentence. We stand by the science behind our project. It's rigorous, it's up to date.
I better write an op-ed and explain what we did and why this was, a science effort, that this was not a political effort. The Washington Post accepted it almost right away. And I woke up the next morning in Singapore with an op-ed published in the Washington Post. To set the record straight, our study was carried out with no interference whatsoever from any political party or institution. It was based on a careful examination of all of the deaths officially reported to the government of Puerto Rico between September 2017 and February 2018.
We received the report from George Washington University, which was commissioned by our government. There are a series of recommendations that were established in this report. We can take some of these recommendations, deep dive into them, and make them executable so that in the event of another catastrophe, we are better prepared for them.
This was a landmark study. To put it in the words of our research participants, Hurricane Maria rewrote the books. Hurricane Maria made us rethink how we view disasters, what really happens in a catastrophic disaster. Our study helped to unveil the experiences of the people of Puerto Rico and informs the direction that the science should take.
I'm hoping that as a result of this work, that we see a change, not only in Puerto Rico, in terms of how we monitor deaths and how we communicate about deaths around disasters, how we work to prevent deaths, but that we see this across the world.
We have to understand how it happens, how we build hospitals, how we build primary care settings, how we build pharmacies, so they can resist a hurricane or an earthquake and be a resource for the community.
I want to see these methods expanded to look at health impacts other than death. Illnesses that are caused, disabilities. I want to see us go all the way to this because I think we need to do what we can to protect people, and especially those who are most vulnerable.
So what are the three important elements of crisis? For me personally, and I know for the rest of the research team, we knew how important this project was. We knew that this was a big responsibility. And I think because of that, we really gave it everything we had.
We've gotten about 5 new ones today.
I use the term fearless science. So I think the legacy of that shows that we can do that type of research. It's powerful. It will forever be part of GW's story, and that we're very proud of it, and that students can learn from it.
I have never been involved with research other than this, where you have the idea for the study, the funding for the study, the results to the community, the results published in a journal in under 1 year for science that is lightning fast. And I am proud of that. And I do think that sense of urgency is part of what helped to propel us there. The fact that we were so committed to wanting to have the answer for the public. A clear answer that we could feel we could stand behind forever. Okay, so we now get to hear from our panelists, the members of the faculty who were featured in this film, starting with Dr. Carlos Santos-Burgoa, Zarnecki. Carlos.
Thank you very much, Dean Goldman. I want to talk about this in the context of the 200 years of GW. And I want to raise 3 issues on lessons learned. The first one is on the principle of institutional architecture for research teams. For team research, sorry. By September 20th, 2017, Hurricane Maria devastated Puerto Rico. And on September 28th, 8 days later, a town hall on the school's faculty with our new president, LeBlanc, we made him aware of the tremendous resource that GW could mean to assist Puerto Ricans. On October 3rd, 5 days later, a group of us met with Dean Goldman to discuss how could we contribute. We contacted colleagues at the University of Puerto Rico to check on their welfare and to ask how we could support. GW offered the continuation of courses for their students here at DC. However, they were on survival mode. We just could not help at that moment. The opportunity came after the talk with Governor. With Dean Goldman, we first assembled a school-wide team that is listed in the film. Negotiation with the government was on the scope of the project, the resources needed, and the requirement to include the local University of Puerto Rico. We needed the University of Puerto Rico. The latter was achieved just a couple of days before the public announcement. And UPR responded with commitment, with trust. In the moment of crisis, trust is very valuable, with trust and a strong team of researchers. The modeling of the data required methodologic development. After difficult analysis, Scott Seeger joined the team, a world-leading expert on statistical longitudinal analysis from Johns Hopkins. This collaborative science team was not only interdisciplinary, interdepartmental, interstate, but also interinstitutional. As we were innovating, we needed fresh expert minds and eyes checking on our work. An external panel of 9 advisors provided observations, corrections, and recommendations. To assemble, align, follow up, and support such teams' effort with a commitment to a common mission under huge time pressure, stress, and emergency mood within the team, while balancing teaching and advising responsibilities at the same time, that required patience, dedication, and professional performance from all the team members. No question of our institutional support. I can ascertain that never in my professional life I felt that a team was as much supported as we felt from our school dean, the staff of the school, and the university under this crisis. There was no hesitation for resources, for time, and for attention. This was crystal clear when we were the target of the 3 presidential tweets. And this takes me to the second issue, on the principle of successive approximation to the truth in public health. The people of Puerto Rico were claiming the deaths of their loved ones to be accounted for, to know the true impact of the hurricane. After much pressure, the government of Puerto Rico called for an independent assessment. Let me assure you that it was 100% independent. The government did not look at the draft of the report, nor modify the comment of the report that we provided. Data collection in a semi-destroyed territory was painstaking, talking objectively with people under those circumstances, with institutions, and trying to identify potentials for data alterations that did happen, building safe spaces for everybody to speak up and talk in confidence. The statistical analysis took long hours, days, weeks, weekends of mathematical modeling. We were innovating. Even the 3rd presidential tweet acknowledged this. The qualitative analysis to understand the communication process, interviewing actors, community leaders, people, and then the careful systematization and analysis of the interviews and its interpretation represented a major contribution. And that is why we had to respond to a destructive political statement by the presidential tweet launched at 8:49 p.m. on September 13, 2018. I found out about it during a phone interview with a reporter from USA Today the following morning at 9 a.m. It denigrated everybody's work. We had to protect from the harm the team members and protect its truth, the most important value. Now, we did this with a widely publicized statement that same morning at 11:28 that said, we stand by the science underlying our study. It is rigorous, it is state of the art. We repeated this over and over. This was expanded by Dean Goldman's op-ed on September 15 in the Washington Post, a very blunt op-ed. Yes, the deaths were accounted for accurately. 1 year later, meeting with a well-known person in a conference at San Juan, Puerto Rico, when he found out that I was from the GW team, almost in tears, he told me, and I quote, "After the hurricane, I came to Puerto Rico to bury my grandmother. Her death clearly attributable to the storm. It is until now that her death has been accounted for. For that, I thank your team." What a better recognition. This method has been applied to other disasters, and it is the basis, as Dean Goldman said, on the accounting to assess the total excess mortality of the current pandemic of COVID-19 in the states of the United States and in more than 40 countries. Now we are deciphering the causal path of the Puerto Rico excess deaths. Funded by the National Institute of Standards and Technology, we are advancing on the cause-specific excess mortality, performing geographic analysis, surveying key informants related to the disease and their hospitals. This will advance on how to classify diseases related to disasters and to support new standards on hospitals buildings. The last issue I want to raise is on the principle of expedited translation of knowledge into policy and practice. With the advisory group, we produced a report, including recommendations to the government of Puerto Rico and to the federal authorities. The team developed infographics for the population to understand the message. We decided to deliver the results of the research to the people of Puerto Rico and its government before it was published in a peer-reviewed journal. In that time, there was no this practice of preprint publication as we have it now with COVID. We worked with Lancet Planetary Health to release the report as it was considered for publication as a peer-reviewed article. But none within the team doubted on the commitment to address the urgent public health need. We do not regret this, and we all assume its consequences today. Release our data, our results before it's published in a scientific journal. A message to researchers and students: do not delay action on your results, nor save them in your computers, as knowledge is best tested in the practice of real-life interventions. So these are my 3 thoughts after seeing today's documentary. The importance of an institutional architecture to support team research, especially in public health crisis research. The principle of successive approximation to the truth in public health. And third, the principle of expedited translation of knowledge into policy and practice. That's my message. Thank you, Lynn Goldman.
Carlos, thank you so much. Now I turn to Elizabeth, Dr. Andrade. Hi, Elizabeth.
Hello. Hi, everyone. Thank you so much for this wonderful event. It's really nice to see everyone again and bring the team back together one more time. So if I had to follow on Carlos's talk, I guess I would say that I would also like to reflect on my experience with this project. And I'd say that there's about 4 main takeaways that I could say that I really carry with me today after working on this project. And the first one is to really trust your training and your experience, but to never stop questioning. And for me on this project, trusting my public health training in this case was easy because I am a proud alumna of the GW Milken Institute School of Public Health, where I completed both my master's and doctoral degrees. So for me to be part of this project really was particularly meaningful to represent GW. But in the case of this work, more than just training was needed. And my background conducting community-based research with Latino communities really laid an important foundation for my involvement in this research. And one of the most important ways that this came into play was conducting research that was respectful. As Carlos mentioned, and as Dean Goldman mentioned, we were interviewing community stakeholders about deaths following a tragedy. And understanding certain cultural elements was really essential to honoring these lives lost. And there were also moments during work in this project where we were faced with areas of science where things were not entirely clear, or there were areas of science that were still evolving. For example, we identified some major gaps in the Centers for Disease Control's current crisis and emergency risk communication guidelines on communicating with the public in crises. We identified that there are still no national guidelines for communicating about mortality following a mass fatality event or disaster. And there are no guidelines on how to communicate with the public in a catastrophic context like Hurricane Maria, where there are disrupted surveillance systems, limited to no communication channels that you rely on in these as a communicator. And so we learned to never stop questioning. Trust your training, but never stop questioning, and that's an important takeaway. The second one I would say is humanity and compassion first. My dedication to this project was really bolstered by our team's shared sense of commitment to the people of Puerto Rico. And in this case, the responsibility was tremendous. We were helping to be a voice for those who had passed away. And we were tasked with interviewing people who were, in some cases, emotionally hanging on by a thread. I'll never forget certain interviews, for example, with first responders who themselves had experienced great personal loss, but who were still showing up to care for their communities, and they were holding it together. There were many communities we interviewed who had lost many members of their golden generation. And after the mortality study found that 85% of excess deaths were among older adults ages 65 plus, I felt a personal sense of dedication to sharing their stories. And so I've been continuing this work and have an article that will soon be published in Disaster Medicine and Public Health Preparedness that sheds light on just how much work we still have to do to protect our most vulnerable members of society. The third takeaway I would say is to expect anything, prepare for everything, and adapt. My years of public health practice and research, including in low resource settings in Latin America, really acclimated me to adopt a certain degree of readiness when it comes to field research. Expect anything. And this was the case for this project. For example, when we were in Puerto Rico collecting data, there were repeated island-wide power outages. And we were relying on our computers and our recording devices to collect the data in a very short amount of time. We were charging our recording devices in rental cars, charging our computers in restaurant offices, using the old-fashioned stop and ask for directions instead of GPS to get to these remote communities to do our interviews. And, we even had a driver who got trapped in an elevator because of electrical outages and surges. And, he had the car keys, so we had to get him out, right? And what do? We go around the back of the building, we find the circuit breaker, we get the elevator working again. So training is great, experience is great, but you have to expect anything, prepare for everything, and to adapt. And the final, I think, takeaway from this project, it makes me think of two very important lessons that my mother taught me growing up that I take with me today. Resilient people just tend to do better in life. And also to always look for the best in people. And without a doubt, this is what we saw in the communities we visited to collect data for this study. Communities with an unwavering strength in the face of tragedy. And these glimmers of resilience prompted me to pursue more research, a follow-on study, to find out, what were these factors that really contributed to disaster resilience following Hurricane Maria. And my hope is that the findings from our research will contribute to better preparedness, protection of populations moving forward, as well as better communication with the public in disasters. So thank you very much for attending. Those are my 4 takeaways of lessons I've learned through working on this project.
Thank you so much. The next speaker is Dr. Ann Goldman. And I know, by the way, that that Mr. Milken may need to leave at some point, but hopefully, if he leaves before I have a chance to say goodbye, I just want to again thank him for having been able to join us. But Ann, not my relative, but we sometimes get each other's emails, and it's welcome, Ann.
Lynn, the team is too strong for me to leave, and I'm learning a great deal from these lessons learned.
Okay, well, let's hear from Ann.
Thank you. Seeing the film brought back to me the morning of September 21st when I was watching aerial photographs and footage of what had happened on the island after the hurricane, when the hurricane hit. I was heartbroken. This was my home, and I desperately wanted to help. So when Dean Goldman contacted me after the university had been asked to do the independent study, I was delighted to be able to do something for my home, my friends. And one of the things that I learned is that it's not a question of being prepared for emergencies. Public health systems have to keep working to refine their tools so that they are prepared at any time. It's not just when the emergency hits, but always. And this could be seen in other aspects, such as the electrical power grid, communication systems. Everything collapsed in Puerto Rico. I was tasked with working on a evaluation of the Puerto Rico surveillance system, the mortality surveillance system. And to do that, we talked to people in the government and stakeholders in the community that was involved in death certification and death recordation. And we also had to establish whether CDC guidelines for mortality attribution disaster were followed. And another lesson is that as part of that preparation, you can't bring somebody new rules to do something when a disaster has struck. They have to be prepared beforehand. So for me, the storm highlighted the plight of the island in terms of public health infrastructure needs and urgent resource needs. It also established a foundation of collaborative partnership that we continue to build on between our school and the University of Puerto Rico Graduate School of Public Health. It emphasized in a meaningful way to the Puerto Rico Vital Statistics personnel the need and the importance and the accuracy of the information on the death certificates. One of the findings was that the death certificates were not being filled out properly. And so it was difficult to know whether deaths were related to the disaster. The Puerto Rico Vital Statistics System did obtain funds afterwards to prepare for the following hurricane system and create an online course for physicians. And it included a module on doing this in disasters in terms of being able to attribute a storm to a disaster, a mortality to a disaster. The program was implemented before the 2019 hurricane season began, but it did not train enough people, and completeness of death certificates is still a problem in Puerto Rico. This has come up now with the COVID-19 study that was conducted by CDC last year. And it was finally after that study that the Puerto Rico Health Secretary made a course on death certification, a requirement for all physicians. It's important to note that incompleteness of death certification is not just a problem in Puerto Rico. This is a problem across the United States and the world. And it's very important for our societies that we have information, that we enable families and to have closure, that we understand how these deaths occurred. Our work in the Maria mortality and injury study will help us develop more information on mortality attribution and tools to establish it. And thank you.
Thank you, and thanks to all of you. So I would like to move into a discussion about some of the broader implications. And of course, even though it happened well after Hurricane Maria, I think that much of what we have been talking about in terms of our findings about the hurricane have become much more of a public knowledge in the context of COVID-19 and the pandemic we've experienced over the last 12 months. And one piece of that I wanted to first mention, and many of you alluded to this in different ways, but the ways in which the pandemic has exposed the weakness of the public health infrastructure in our country. And we saw that in Puerto Rico with the weakness of vital statistics, but then we see that nationally in the United States, that CDC had trouble tracking the COVID pandemic. And in fact, other universities like Hopkins had to step in and help with that. We also have seen that in the lack of connection that Ann Goldman was mentioning between the medical community and public health, the intrinsic role of medicine and public health in terms of its ability to properly diagnose, provide the information about deaths. And we've seen in many cases, healthcare stepping up to the plate. In other cases, that there's the fragmentation that we have in the US between medicine and public health that has been kind of laid bare really in both contexts. And then of course, in the communications realm as well. And even though there weren't the guidelines, I think we also saw that they didn't have the staff, they didn't have the resources, they didn't have the wherewithal. They may have known who needed to be communicated with. That helped us a lot in partnering with people in Puerto Rico, but they didn't have the capacity. And so to maybe go to that issue of the capacity of public health and what we've learned and what you think needs to be done to address that, especially us as a School of Public Health.
If I may, let me jump in. Thank you for this question. Really, what we saw in Puerto Rico was a preview of what we were going to see now with the COVID pandemic. This weakness of the departments of public health and how we are, how strong we were. A tiny example: the areas of vital statistics and the areas of epidemiology that was Ann Goldman's work. She had to put them to talk each other because basically in some jurisdictions, they are within the same department of health and others might not, but they don't talk each other. And the logic is different. Vital statistics, they are enacting a legal document. Epidemiology is tracking diseases. But the use of mortality to track diseases is key. We learned that in Epi 1, in our first course of epidemiology. But in practice, we don't use it. And it is amazing that we were, in the month of February, March, April, identifying the total excess mortality being higher in older people, in low socioeconomic levels, in certain regions of the island, when it had already passed. It was history. Nothing could be done about that. Okay, so the critical thing now is how can we use mortality as an indicator to act today? If somebody dies today, how can that make me, as a public health officer at the district level, to move forward and act? Don't wait for 6 months for that. And I think that this calls to really a major, I would say, in terms of, in the context of 200 years of GW, we have to realize that we have, quote unquote, a handicapped public health infrastructure that needs to be really shaken and rebuilt. And it's I would say hard to believe how much work we have to do in Puerto Rico, yes, but let's do it in DC, let's do it in Virginia, let's do it in Maryland, and let's do it throughout the world.
So I'm going to actually ask each of you a question. I'm going to turn to Anne now, but kind of in this vein. But so both in the case of COVID, but also disaster-related deaths, many of those who die are more vulnerable because they have underlying health problems, perhaps are elderly, perhaps have other risk factors. And especially when you count, as we have said we should do, if you count the indirect causes. So the indirect causes might include that somebody with cancer was unable to go get treatment, should have survived another few years, could not go get treatment. Someone with renal failure could not get dialysis. Someone with diabetes could not get insulin. And so how should we be thinking about it? It seems to me that how we think about death is so simplistic. We recently had a press release, that now, COVID is the third leading cause of mortality in the country. But we know some of that is, there are multiple causes of death, right? How should we be thinking about this, Anne? And how do we think about this in a way that particularly shines a light on how we can take on the preventable causes, like taking care of people after disasters?
Well, that's where a good surveillance system, whether it's mortality or other types of surveillance systems, come in handy. You know your population and you can keep track of it. It's like that it shouldn't be news to you that there are particular packets of vulnerability in certain areas, and there are ways to help people prepare for disasters. There are also the educational programs that can come in through communities. And I think that's an important thing, is to bring communities into understanding what their health is, what their role can be. Because one of the things that did happen in Puerto Rico was that there were communities that banded together and they helped one another. And some of the health providers that I met there told me that. They said, we made friends that we will owe, that will last forever. And they had a list of people who were in a vulnerable situation. And that is something that a government, that's static information that a government may or may not have, but it's something that if people are aware of their risks and conditions at the community level, they can deal with.
Thank you, Anne. So Elizabeth, the experts that certainly are there in Puerto Rico, we really did find that there were many people who we could work with because they were very knowledgeable about what was going on with health and healthcare on the island, epidemiology, statistics. But where does the breakdown happen between the availability of the expertise and the communication of good information to the communities? What broke that link in Puerto Rico? You're muted, I'm sorry.
Thank you. So just to confirm, I understand. So where did the breakdown happen between people with the expertise and could you, could you elaborate a little, or?
The communication of that information to the people.
Mm-hmm. Sure, yeah. Well, in the case of Hurricane Maria, a lot of the resources and channels and protocols that are in place, when we communicate following disasters like these, they're all predicated in the plan, right? And many of the plans that are developed depending on the kind of the level of disaster that's anticipated. Well, in this case, in Puerto Rico, many of the disaster plans were appropriate for about a Category 1 hurricane, right? Not a Category 4, almost 5. And so in other words, they just didn't have the contingencies in place. What happens if there's massive power outages? What happens if we don't have telecom? What happens if cell towers are down? And so they just didn't have those contingency plans in place. And there was, according to our study participants, there were some missed opportunities to use strategies like plain, they called it de pie a boca, so from foot to mouth. You walk to someone and you tell them, right? Just interpersonal communication. People from communities who would go to the Center for Operation and Emergencies and would convey, we're having people dying from this, or we're having increased cases of leptospirosis. And that information was just not strategically gathered, given a lot of these outages and that they didn't have the resources that they were accustomed to having for communicating. So I think it all comes down to having those plans, having contingencies that are appropriate, and really being versatile and pivoting and using whatever information you can get, for decision making. So I'd say that was the major disconnect in this case.
And I have a question in the box about the Texas ice storms and whether the strategies learned and used in Puerto Rico are being were being deployed in Texas. And I would say that actually in some cases they were, that I'm aware of. I know some of the public health officials in some of the parts of Texas who were involved who were actually very knowledgeable actually about Dr. Andrade's work and similar work, and were very concerned about how they were communicating. And I think that, in common with Puerto Rico was the loss of power for several days, but it was several days and not several months. So it was nowhere near as dire of an event. However, there were large parts of the state that had no drinking water for many days, and which was a different aspect to this. And of course, a complete lack of preparedness for cold weather caused a lot of carbon monoxide poisoning because of people attempting to warm their homes. But I did notice that at one point in time, the Department of Health for the state of Texas doubled the death estimate. It was nowhere close to the Maria estimate. It was like something like 111 deaths. But that they did recognize that, even some of the things that happened, like there was a 20 car pileup or 6 people died, that wouldn't have happened without the ice storm. And to take into account some of those events, which certainly caused death, even though maybe it's not death from freezing, but certainly related to the storm. Now, have they really assessed the total mortality? I'm not sure. And I wouldn't be at all surprised to see further revisions of the death toll in Texas as more data come together. Doctors Santos and Goldman can tell you it took quite some time, a few months, before we could feel we had a complete list of all the deaths, and that list was accurate and was solid enough to use for this study. Even though we did it quickly, we needed to make sure that we had a complete count. We're at the close of our session. turning back to Mr. Milken, do you have any final words for us?
Well, for me, it was extremely informative in the challenges. And I think it underlines all of the statements on preparedness that's required. And data, who's on dialysis, where are they located, et cetera. And it can save considerable lives. And I think as it backs up, how do you build infrastructure that can withstand? Do you build it underground? How do you structure it from that standpoint? So as I said at the beginning, I think the lessons learned here can be applied not just in Puerto Rico, but around the world, as the people that worked on this project pointed out. And I look forward to sending this documentary to all of the members of the Giving Pledge to think about what they might be able to do in different locations around the world to prepare. And I would hope that we could get a follow-up here to focus on preparedness and a list that everyone can get a checklist so that they can get prepared prior to the emergency occurring.
Thank you so much. In closing, happy Public Health Week to you all, and happy Bicentennial year to the George Washington University. Goodbye, everybody. Thank you so much for participating today.